Hello, I'm Dr. Rafi Romano. In the series of movies that I'm presenting you, I want to concentrate today on a procedure we are doing in our office on a daily basis. This is something that's very helpful, not only to move teeth in orthodontic procedure, but also to help with some relapse and some minor tooth movement strategy, which is today very popular in adults. And many adults come and they don't want a very complicated full treatment. They especially don't want to pay that much. So I'll give you my technique of how to do it manually with my staff in my office without any cost involved. I will present this technique through a case that I've done. The case has class 2 div 2. The upper centrals are retruded, the lower laterals are protruded. Deep bite, very, very typical for class 2 div 2 case. Now, of course, the treatment is a very complicated and can and should be treated with a full 2 arch, maybe even with extractions. But how many patients really are willing to go over through this procedure? This patient came to me only because she needed to replace a filling in the upper left central incisors, and the prosthodontist says, I cannot do it because of the overlap of the lateral, so I need some help. So we do it in a very simple way in our office. All you need to do is have a plaster model and vacuum machine that can prepare these vacuum clear aligners. And I'll show you the procedure. So these are the materials that we use. We have a burr, we have some plaster, and now we have to prepare the tooth. With the burr, we create some pressure where we want to move the tooth. In this case, we want to move the tooth buccally. So I prepare a pressure point on the plaster on the palatal side. Now I add some wax. It can be wax, it can be some composite. On the opposite side of my pressure point, if my pressure point is palatally, I add some composite. In this specific case, I added the composite on the mesial side, so I get more rotation, not only buccally movement. Now you take this plaster model to the vacuum machine. In this case, this is the old traditional vacuum machine that many clinics still have them. And after sometimes, if it's done properly, you get a vacuum retainer or clear aligner. Here you can see this is the old fashioned. I have now in my office the Mini Star, which is much faster and much accurate. But not many clinics can afford buying this Mini Star. So here is a clear aligner. We cut it with some electrical knife. Very fast and very nice. You can cut exactly where you want it. You get the clear aligner, you polish it, you cut it, make it nicely on the patient. And all this procedure is probably, for me as a doctor, is around 1 minute to take the plaster model, prepare the pressure points, and for the staff, another 5 to 6 minutes. Here the patient trying in the clear aligner. You can see it's very, very static and no one see it. So here is the plaster model in this case with the buccal pressure and the composite on the contra-opposite side. Here it's on the mesial, so the composite or the wax is on the mesial to allow the tooth to get inside and rotate. Here is a patient you saw before, the class 2 div 2. This is after 6 aligners made in my office. And this is after 8 aligners. Each aligner was in the mouth between 2 to 3 weeks. The cost of each aligner is around $1 for the doctor, and you can charge as much as you want or you prefer. And this is not a perfect case, but this is a very, very nice, if you see the before and after, this is a very nice service you can do for your patients. It can be done for relapse of cases before renewing the splint, the permanent splint. It can be when patients have some tendency for tongue thrust and you want to have some pressure points to avoid relapse. All this is very easy and done in my office on regular basis, basically by my staff. If you want to hear more tips, more tricks, you can go to our website, drromano.com, or to the YouTube channel, or to the Facebook. See you in my next tips and tricks. Thank you. Bye-bye.